land is your land, this land is my land. From California to the New York Island, from the Redwood Forest to the Gulf Stream waters, this land was made for you and me.
Hello, I'm John Grom, and welcome to the 27th Right and Left Discussion Forum. Our purpose is not to avoid disagreement, but to objectively examine different opinions with a view to finding common ground. Knowing that partisan conflict makes problems worse, rational people turn to civil reasoning. We are going to test the civil waters today with a discussion about the various features of the Affordable Care Act. Our panel today, beginning on my left, is Jerry Ritzman, Vice President and partner of Ritzman Natural Health Pharmacies. On his left is Patty Haskins, Democratic member of the Wadsworth City Council. On her left is Bryan Laubaugh, President of R&B Financial Services. And on his left is Tim Burns, Manager of Adult Services at the Twinsburg Library. Panel, I'm going to leave this up to you to decide who leads off. So here's the lead. Over the last 2 years, there has been almost constant conversation about the Affordable Care Act, or Obamacare, which is a term I don't like. When listening to pundits and politicians, one gets the notion that almost no one is neutral on the subject. It seems like most people are 100% for or against. An old English proverb said, "It is an ill wind that blows nobody any good." Now you're going to have to think about that one for a little bit. I'm going to repeat it. It is an ill wind that blows nobody any good. But there must be both good and bad in this act. What are your thoughts? Patty?
Actually, I agree with that. I think there is good and bad. First of all, I think we have to recognize that the Affordable Care Act was a compromise, so to speak, for what was originally on the Democratic platform, which was a single-payer type system. And then it was reduced down to the system, different system with a public option. Then the public option was pulled out, and the providing of the insurance was then turned over to health insurance companies, which were already in existence, to allow for them to handle that. There are some very good things, though, that I think are in the Affordable Care Act, which are necessities that we need for the citizens of the United States. And these are in line with the consumer protections that are provided. And we've heard this many times before. It does provide for those with pre-existing conditions to obtain insurance. It does cover children up until the age of 26, I believe, which, especially with students staying in college longer, taking longer to get a degree, perhaps not being able to find a job, it allows children to stay on their parents' plan until the age 26. And to me, this is a big one, which I don't hear discussed very often, is the fact that it eliminates lifetime limits. Almost all insurance policies up until this time have had lifetime limits of $1 million or $2 million. I know when I worked, it was, I think we had $1 million, and then it was up to $2 million. With all of the advances we've had in medicine, it's really easy to hit that limit now. Now, obviously not everybody, in a smaller percentage, but once you hit that limit, you were out of luck. So those lifetime limits are prevented now. It also it changes the appealing process. Right now, if your insurance company refuses to cover something that you feel is necessary, there is an external review that is provided that takes it out of the hands of the insurance company, so that you don't have a situation where they're just simply trying to cut costs by not covering you for a particular needed expense. I think all of those things are good, as well as the Medicaid expansion. Now, unfortunately, with the Medicaid expansion, it has not been adopted by all of the states. Ohio, I believe, has. And basically what that does is it extends Medicaid coverage up to, I think it's 132% of the poverty line, 32% of the poverty line.
I think they moved it to 140, didn't they?
140? Yeah, I'm trying to remember exactly what the figure. Unfortunately, what's happened in some states is they've refused to do this. And mind you that when it was put into place, it was guaranteed to the states that went to this that the first year would be covered 100%. and for the first 3 years, and it would change to 90% by 2020. So most of the added expense was being covered by this, but yet states refused to do it. And unfortunately, what that has done, it has left a number of people without insurance because you cannot get subsidies for the Affordable Care Act for any policy that you apply for unless you are below what the federal government has set for the poverty line, which is that 140% of the poverty line. Some states, however, have stated that in order to get Medicaid, and Kansas is one, they've really lowered it. In order to get Medicaid, you have to be at 70% of the poverty line. So there is a group of people that are not qualified for Medicaid in certain states because they are below, and they're below the poverty line, but according to their state, they don't qualify. Yeah. And they don't qualify for subsidies with the Affordable Care Act because they're in between that 70 and that 140. And that is of a concern of mine. So,
Jerry, where do you come down on all this?
Well, I like the fact, I'm not an insurance person, but I like the fact that there's going to be a more broad-based pool to determine what the premiums are going to be. Seems like if we, so many insurance coverages select a narrow slice of the population and base their rates on that. And if you're in the slice that's healthy, your premiums are less. I think a broader based pool to determine the rates is a positive.
Are you assuming that the majority of the young invincibles are going to buy insurance?
I'm not assuming that at all, but although I think today the stats came out that the percentage of the younger invincibles has increased in the enrollments in January. That is up, but I don't know. I don't even know how it's going to go. But I think that's a sounder thing. I think the fact that it's not so tightly tied to employment, which was kind of an unintended consequence of some of the policies in World War II, where medical insurance became a benefit rather than a taxable wage. I think that's a positive thing. Even though it isn't tied to employment, it's more advantageous for businesses and individuals to provide it through employment because of the tax treatment. But that will gradually change and hopefully change. So those are two positive things that I see.
And Tim, did you have a chance to look over some of the features and pick out a few favorites?
Yeah, one of the interesting things was law of unintended consequences. Yeah. You're applying it to prior to this law. But there seems to be a lot of that within the law, things that are actually positive and things that are actually negative, and then things that are maybe perhaps to some people catastrophic. I just went looking through. I was really impressed because I was not familiar with all the levels of preventative care that was covered. I was looking at it from the standpoint because I know there's been so much talk about women's reproductive coverage and the kind of skewing of that ideological point of view. But when I went through and looked at all of the potential preventative care, it was very impressive. But one of the things I found was really interesting was something I'd had no idea about: medical loss ratio, which is if the insurance companies basic profits, extend beyond 85%, or they have to keep it at 85-15, then they're going to have to reimburse the people that pay the thing. And I thought, well, no, that's good.
Excuse me, can you repeat that?
Well, there's and I didn't even know about this. It's a medical loss ratio where if the administrative costs, call it profit for an insurance company, extends beyond 15%. Like say of the whole package, like say the premiums are $100 and they're getting say 80% of it, as opposed to or 85%, it's really kind of complicated, and that's what drew me to it, because I thought, well, that's a good thing, that they were keeping, the profit level to a manageable amount, and that they weren't spending, there wasn't just total profit, that the companies would make maybe an astronomical, you would assume at one point, but they were keeping it fairly close, and that was to increase the efficiency of the companies, maybe the paperwork handling or getting the doctors to agree to a particular price on some sort of procedure. But the interesting thing was, there's a potential not to do that. There's the potential is it might be better just to reimburse the person who's buying the insurance, as opposed to trying to be any more efficient. Mm-hmm. And it's kind of strange, because I thought, boy, that would really do that. But the feeling is that it probably will not. But we don't know yet. Like so many things about the healthcare, it's still, we don't know what the final result will be. And one of the things that really struck me about the whole concept, it's just, I was a single payer advocate, but after it got rolling, and I was impressed that it was a Massachusetts plan, or based on that, or a framework. Though I don't think anybody's ever admitted it since, during the election. But there's a great potential for compromise on this. Mm-hmm. It's very complicated. I really appreciate you picking the topic, because it's the first time I ever actually looked through. Yeah. I was going to print out the law, but I don't have that much paper. Yeah. There's just, it's just potential for great compromise on so many levels, and it seems like, but I'm not sure if it's not taking place. Mm-hmm. We don't hear about that.
No, you don't.
But that's, so.
Okay. Well, Bryan, is there anything about the Health Care Act that you like?
Well, I think everything that's been said so far could have been accomplished without this monster. Mm-hmm. I think if there was, and I'd like to unpack, statements like compromise. There was no compromise when this particular act was not voted. No one in the Republican Party voted for this. That's not compromise. The compromise might have been within the Democratic Party between the group that wanted a single-payer plan and the folks that said, well, if we go with the single-payer plan, we're really going to have problems. So let's compromise a little bit from really bad to this particular plan. I will firmly admit that there were problems in the insurance industry and healthcare that could have been resolved with some tweaking here and there. Within this whole bill, no one's talking about tort reform. Tort reform would shave off billions of dollars. Some people say upwards of 10 to 15% of the cost of healthcare goes towards tort reform. Yeah. Nowhere do you see tort reform in this bill. Mm-hmm. We're seeing now this nasty rollout where just yesterday the current administration has decided they don't like this part of the law and they're going to delay the employer mandate till 2016.
That, by the way, is the 27th change.
Yeah, I'm glad you brought that up. Yeah, that was a number I did want to bring up. When you have legislation, I believe in the rule of law. You don't just willy-nilly decide, well, this is going to help this person over here, this is going to, we've got a midterm election coming up. The folks on the other side of the aisle are running away from this particular act. Mm-hmm. They are distancing themselves from the White House, and they're doing everything they can. Now, there are a lot of different ways that this could have been handled. One is when you talk about a broader base of people, you could have lowered the law where it says that you can't have any sort of cross-state competition. That in and of itself, some people are saying, would have created a boom in the demand for these types of plans. I don't know of many of the invincibles that you talk about that want to pay, especially the 22-year-old single white male that wants to pay for maternity. And so what we're doing here is we're lumping a one-size-fits-all plan into a populace of people that are used to choice. And we're saying, here are the choices that you have. Here's the compromise, which really isn't a compromise, because if you don't, you're going to be fined for it. And there are businesses out there that we talk about the unintended consequences. There are businesses out there that are saying, we will not comply, we'll pay the fine. It's cheaper for us to do that. We'll let our employees just go out and decide for themselves. We might give them a little bit of a subsidy. And that in and of itself, I mean, I just really struggle with this particular type of a takeover of 1/6 of our economy. And where you talk about all the things, when you talk about, it was brought up about how they have profit matrices, you can only make so much. I believe that the market will determine that. Were there abuses? There is in every business. Could it be solved by tweaking some laws here and there? You bet there could have been. Could it have been bipartisanship? Could it have been a bipartisan thing? Yes, it could have been. But every suggestion, every idea that was put up on the other side, as far as the Republicans were concerned, was summarily dismissed. It wasn't good enough, it didn't go far enough, and this particular act, this Affordable Care Act, is purely at the concoction of the current administration and the folks on the left. And they're going to have to live with it because it's not going to work.
One of the things that I have a question about that happened this week with the further delay of the employer mandate, where does that leave employees that were anticipating that their employer was going to cover them, and now they're not for another year? And are they going to be required next month to buy their own insurance or be fined?
Probably, I would think.
Now,
I mean, unless they already have insurance. And some, part of it's bringing up.
Unless the hue and cry gets so loud from those grassroots people that the administration decides we're not going to roll this out. We're going to wait till 2016. For some, it's hard to not put the pieces together of this puzzle and say, why are we delaying it till 2016? Because we have a midterm election. I mean, that's...
I don't know that it's all that. I mean, it's just the midterm election. I mean, a lot of those changes, the 27 you talked about, and the employer mandate. I sat at home and listened on TV to Republican pundits complaining about it. We shouldn't have this. Why isn't the president change it? And then when he does it, there is the hue and cry that he is overstepping his bounds. Now, you can't have it both ways.
But there's a right way to do it. Well, the right way to do it is to go back to Congress, because we have three, we certainly know that we have three distinct branches of government. The Congress makes the laws, and we have the judiciary, and we have the executive branch. And the fact of the matter is, it seems to me that the Congress basically is just sitting back and saying, okay, well, whatever you want. So, you can't have it both ways.
Well, I don't know about, unfortunately, this Congress does not have a good record as far as passage of things. The only thing that the House has managed to pass is a bill to totally repeal the act. How many times is it? 37 or
at least that many.
47 times.
And our congressman voted to repeal it every time.
Exactly. So they're not willing to work with this. Their whole purpose, in my opinion, is to make it fail. As far as no compromise, I think there was compromise on the Democratic side, changing the policy, trying to get Republican support. Unfortunately, the Republican alternative was tort reform and across state lines, and that was it. Those were the only things I ever heard from them. They
Those
did
are
not.
the two big ones.
Well, there's a lot of other big ones, and that was the only thing they would consider, and it was, I'm going to dig my heels. Now, this is just my opinion and what I saw. I'm going to dig my heels in the sand, and I am not going to move on this. So it got to the point that the Democrats did pass a bill, which is flawed, I think, because they did make too many attempts to compromise.
One of the things I think is more difficult for a Republican point of view, such as that you're putting forward, is what did you do? You had the House and the Senate and the Supreme Court at one point with George Bush, and there was nothing put forward. Truman tried to put it through. I mean, we're going way back in time. So I think that's a difficulty to have credibility for it. Trust me, I would prefer that this be a compromise bill that would come out and address it. My son, who is a teacher, so he's actually covered under the pension, teacher's pension plan, has a lot of friends, young men, that are unemployed, that are either underemployed, I should say, and they don't want to get insurance, they don't want to pay for it, and he's been giving it to me, and I said, I don't think I wanted to pay Social Security when I was 21. Didn't seem right to me. It's like you're paying it forward. I'm not quite sure. I always have a conflict. Maybe somebody can clear it up. When you're paying for this bill as a young invincible, how do you know what portion of that bill? It's just the whole bill. Mm-hmm. I'm not paying for maternity or I'm against birth control, so I'm paying for the bill, and that is included in it. Mm-hmm. So I guess in a way I don't see it. I know it's tough, and it really is tough, but that's what we do. We pay it forward. So,
well, I think this bill is not going to go away. Yeah. It's not going to get and it's going to be years until we really see what the total effect of the Affordable Care Act is. And I think it's going to be a generation or two until some of the assumptions that were made and written into this bill about preventive health care and that type of thing, till we really know if they're going to be effective. I see right now some of the assumptions that have been made and written into the bill, people are gaming the system, particularly in the healthcare world. The assumption was made that electronic medical records are going to improve care, and they're going to improve accessibility, and everybody's going to be able to see. That's not happening. And in fact, I think it may be adding to the cost, because the physician base right now is not able to manage the
paperwork,
electronic medical work. So they're hiring scribes to come in and do it. So they've added somebody there. That's one thing. Getting a little bit more technical, the payment system they're trying to move towards results-based reimbursement. And how do you tell if some physician or some medical group is having good results? Well, they don't have total control over that. Patients have a lot of control over what their health care or what their health condition is, or how healthy they are. Plus, patients don't have all the control over it because of genetics. Mm-hmm. And so, but the reporting systems that rank medical plans and so forth, some of those people have figured some of those out to say, you know what, we can get these ratings improved so we get bonus payments, and we can do it not by concentrating on our whole insured group. They can predict through predictive behavior who they need to concentrate on to get their ratings up, and then and then pretty much ignore the rest. So we'll just have to see, but there's been a lot of assumptions made.
That's true.
That have not been proven out in the past and have not been proven out yet.
Let me lay this question on the table, because it's been bothering me quite a bit. Tim, you talked about the preventative care features. And one of the elements of the preventative care features, particularly as it applies to women, is a no copay birth control program. Yeah. And I'm thinking about that compared to medications for chronic illnesses, and there are copays. And that I'm trying to justify in my own mind why we can support recreational sex and not diabetes and Parkinson's and
obesity.
Well, one is preventative and one isn't, I think. It's that the contraception, whether you agree with it or not, is considered a preventative care.
I think you're looking at.
I'm just saying the way it reads. Yeah.
It's when recreational sex is preventing transmittable diseases and things of that nature. The fact that the person's having a good time may
me.
not have.
I hesitated to use that expression because I wondered what other kind of sex there is.
And with all due respect to Patty, this was one of those things that the administration played to their base because we had a war on women going on. Okay, so that had to be part of this, and that sadly is the unintended consequences. People out there that actually have disease that could be prevented. Type 2 diabetes, we had a whole program on it. They're not getting the help that they need, but the individual that says, yeah, I should have my birth control for free, gets a pass on it. So I would agree, it's really hard to square that away.
It may also be a red herring to wave and garner a lot of attention.
Sure.
Because there are an awful lot of preventable illnesses that are covered under the, preventable procedures that are covered.
There was something else I wanted to put on the table before we run out of time. In looking at who benefits by the Affordable Care Act, we haven't talked about hospitals that put out millions and millions of dollars in providing free care. They're going to benefit because they're no longer going to have to do that, I don't believe. And the uninsured, though, are not getting the same quality of care that the insured are.
Right.
When they show up at an ER. There are just a whole lot of things that they're not going to be.
They get maintenance care.
They're not going to be treated for, and that so they're going to definitely benefit by all this, and there are people who are historically been denied benefits because an unscrupulous insurance company would go back and look at their original application and find some tiny little error and deny them benefits when they just ran up $1 million tab. And that is going to be eliminated by the Affordable Care Act. But I think that the people that are going to lose, though, are small businesses. They're going to have to fork over a lot of money. It's going to go to their bottom line that they didn't have to before.
And I think you're going to lose small regional healthcare organizations because the consolidation in the healthcare hospital industry is just, in order to be able to survive the economic impacts of the Affordable Care Act, the consolidation frenzy is going on.
Yeah.
We can see it here, and we can see it probably across the country.
Yeah. Well, folks, you want to renew this subject?
Could do this for
3 hours, yeah.
I want to thank you and thank everybody who joined us today. And I'd like to leave you all with this very confusing and complicated quote from Samuel Beckett. Let our conversation now be without precedent in fact or literature, each speaking the truth to the best of his knowledge. There will be a test next time for you to tell me what that means exactly.
I'd have to read it again.
Thank you.